Hello, everyone. Dr. Nikhil Verma here. Tonight, I am privileged to be with my guests over at Dragonfly Wellness um, to discuss this topic about chronic pain and how just medication and just intervention and just surgery isn't nearly enough for us to get out of our chronic pain cycles and really help us live our most fulfilled lives. Um, we have been working together on this project for about 3 to 6 months. We were really excited to get this together. So bear with us if there's some errors or some things that don't go as smoothly. We're just trying to experiment to see how well this works out. Um, as you can see on the slide here, is the current evidence of current evidence-based practices of pain management. We really want to go deep dive into all these topics, but this is more of a general overview of the recent practices of pain medicine, what I practice, and what the changes that we're seeing are. The biopsychosocial model, um, advice against opioid medications, and we know that there's a big issue with these both on the political and social side. Um, what other treatment options we have for chronic pain, mindfulness techniques, and the significance of diet and exercise, strength training, cognitive behavioral training and therapy, medication choices, sleep, and other interventional procedures that may be available for you. So without further ado, again, I'm Dr. Nikhil Verma, owner and operator of Essential Sports and Spine Solutions in Columbus, Ohio. Um, Privileged to be here with Dragonfly. We have Francesca Festa, Alicia McDonald, and Marie Rose. We could not have done this without their help over the past few months. And this is why it's a joint effort, and we're actually in their facility this evening recording this video. And also special thanks to Saluda for offering to help with setting this meeting up. So without further ado, I'm going to move it on to Francesca. Take it away.
Thank you so much, Dr. Verma. So let's start. You can see the first slide, please.
Yep.
So my name is Francesca. I'm a licensed professional clinical counselor here at Dragonfly Counseling and Wellness. And today, together with Alicia and Marie, we're trying to help you have a better understanding of pain and chronic pain in particular, and how counseling can help you. So let's start with a brief definition of pain. So what's pain? I chose the definition from the International Association for the Study of Pain. It's a revised definition from 2020. And so basically, it's an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So as we reflect on this definition, I really would like you to think about a few concepts. First of all, pain is personal. There is no pain without an interpretation, and that varies across individuals. So pain is personal, first of all. Pain is learned. We learn since a very early age, from like our experiences as children, what's pain, and the fact that pain is something to react to respond to be maybe worry about, to fear also, right? So, but even that is different from individuals to individuals, right? And then one more reflection is pain can be both adaptive and maladaptive. So adaptive means that we need pain to survive. So we need pain to avoid harm and injuries, right? And so it's the signal, say, hey, do something, alarm, danger, right? So pain is actually helpful to a certain extent. Can become maladaptive, but when it prevents us from actually engaging in activities, behaviors, doing things that can be actually helpful and healthy for us, for our physical and mental health. Next slide, please. So let's start also with a differentiation between, acute and chronic pain, because tonight we're going to focus on chronic pain. And I would like you to keep in mind that at least 20% of the population, I'm saying at least because it's data keep changing and it's difficult, to say the exact number, but at least 20% of the adults in the American population actually suffer from some form of chronic pain. It can be fibromyalgia, arthritis, low back pain, headaches. So, but that's very relevant and very common in the population. Okay. So we usually think of acute pain as usually is connected to tissue damage, is a normal physiological response, usually helps warn of a disease progression, is usually expected to resolve, and is usually a symptom of something else, of a disease or an illness. In terms of chronic pain, it's a pain that persists for at least, more than 3 to 6 months, is not expected to fully resolve, may or may not have underlying medical conditions, and is not connected to ongoing tissue damage. Okay, so if I can have a next slide, this is what I want to show you. This is really important because we're going to discuss this tonight a lot, right? The chronic pain cycle. What happens when we suffer from chronic pain? When we suffer from chronic pain, we tend to engage less and less in physical activities. We maybe don't meet with family and friends. We don't go to parties. We don't work out. We do not live our life like we normally use to live, right? So there is a decrease in general activity, right? That is going to affect the way we feel about, we may feel depressed, lonely, isolated, irritable, anxious, and that affects the way we think and we view ourselves. So the relationship we have with ourselves and other people around us affects our relationship with our partners, with our friends, with our, co-workers, right? Family members. So in terms that really affect our self-esteem and the overall quality of life. So tonight, we're going to try to give you some tools to break this cycle. So some very effective tools that you can even practice at home to really break this cycle. Okay, so I'm pass it on to Alicia.
Hi, I'm Alicia. I'm a licensed professional clinical counselor here at Dragonfly Counseling and Wellness. And I'm going to talk to you a little bit about the gate control theory of pain, which is a super important theory. It's super important because it's central to what we do and what's behind the things that we're going to talk about today. So essentially, the gate control theory of pain holds that we have nerve impulses that run up and down our spine, up our spine into our brain. And in our brain, it processes our perception of pain. And along the way of our spinal cord, those nerve impulses are confronted by a series of gates. And those gates, they inform whether or not that those pain nerve impulses actually reach the brain to process pain, or they don't at all. So if the gates are closed, then a person does not experience pain. But if those gates are open, then the person does experience pain. And there are different factors that influence whether or not those gates are open or closed. And some of those include our mental, emotional, physical, and behavioral. Some examples of factors that close the gate include happiness, relaxation, enjoying activities that are pleasant for us. And those factors that open the gate include stress, tension, mood, and also inactivity. And so I'm going to turn the screen over to Marie so she can tell us a little bit more about those factors and how they influence your perception of pain.
Hello, my name's Marie. I'm a counselor intern here at Dragonfly Counseling and Wellness. Just getting everything pulled up, sorry. So I wanted to discuss the biopsychosocial model. It really kind of expands on how chronic pain touches many parts of your life, and that each of those pieces affect the other parts within the model. And the interaction between each of the circles on the screen here, biological, social, psychological, coming together with mental health as well, show how they impact each other. So an example of biological would be things like pain, medical issues. Psychological would be emotions, the attention you have to those emotions and thoughts. Social would be things like your relationships, your job, your community, hobbies, and things like that, and how they're all interrelated and interconnected with each other. The good news is, while some factors may increase or turn up the volume on pain, other factors may decrease it. And I actually don't know who I'm turning this back to. Sorry. Is this to you?
That's okay. So
Yeah.
we were going to have an in-person presentation as well. And we're going to talk about this questionnaire a little bit. If you guys want to enlighten us just briefly about this, and if you're watching at home, might be a good time to hit the pause button and read over these and see how you scale on this this scale that we use for our clinical research, our clinical data, and kind of show effectiveness of different modalities that we use.
So did you want us to talk about how we might utilize this in counseling or?
Yes, exactly. To kind of briefly describe what you use it for, and I think that'd be advantageous for anyone out there watching to see why and how this is utilized.
Yeah, absolutely. So when we're working with people with chronic pain, it's a good idea for us to get kind of an idea of how all of these factors from the biopsychosocial model are interacting with each other. And this questionnaire is a really good place for us to start to get kind of an idea of maybe what's out of balance. And then also we can provide it incidentally throughout therapy to see what kind of progress we're making. Do you have anything else to add?
I think it's good.
Okay.
Yeah, fantastic. I just want to point out the highlight that what these questionnaires, obviously there's a portion for activity, sleep, mood, stress. And as these clinicians have talked about how these are all parts of the biopsychosocial model and how important it is that people that are often in pain ignore these things, but they actually go hand in hand. So I think that's a very important point to take home. Let's see next. Okay. So I thank you guys for that portion of the presentation. We're going to switch gears a little bit and talk about some of the medical interventions and some other concepts that more on the medical side that can be beneficial. And for me, as being my training is in physical medicine rehabilitation, everything for me boils down to being able to be a functional person in society. And now, when you're in pain, that can be very, very difficult. Your chores can get put aside. You can't care for yourself sometimes. You can't go get groceries. Sometimes you're just stuck in bed all day. So the importance of regular exercise, keeping our tissues are what make up our body, keeping everything able to move, keeping everything into a very fair amount of range of motion, making sure we're not hurting ourselves by just doing small activities day to day. So this is why important for daily exercise and get your body moving. Now, this doesn't mean you have to go run marathons or do something very significant, but this can be as simple as walking every day, walking up and down stairs, et cetera, et cetera. There's importance of aerobic exercise, meaning where you will want to do something for a long amount of time that your body is capable of doing. This can include walking, jogging, jumping on a trampoline, running, cycling, swimming. All these things are great activities to keep your body moving. But on the other end, there's also strength training, which is very important. The strength training has shown that it's going to increase our bone density, It also releases certain hormones that can keep our joints stronger and more able to avoid arthritis. It can get our tendons stronger, so we're less likely to tear our tendons. It can also release a whole set of other hormones that can help decrease our chances of diabetes and other chronic illnesses. All of it will increase your flexibility, endurance, and hopefully potentially alleviate pain. There's been at least one fascinating study that showed that individuals that were long distance runners were able to tolerate a low level of pain for an extended period of time. And individuals that were more weightlifters and bodybuilders were able to tolerate a high impact of pain, a higher threshold. And the example I want to give is like we see in pro athletes like NFL players that are hit all the time, how they're able to tolerate those hits when maybe someone that isn't playing that sport at that high level may not be able to tolerate. And this is besides the concussions and that kind of stuff, just kind of a generalized example. Number two is the healthy eating habits, and that includes trying to stay away from processed foods, highly sugar foods, highly salty foods. The more processed the foods, the actually worse it is for the body. And this can cause a slight amount of inflammation in the body, which can make us feel like pain is more intense than it may actually be. So eating a low inflammatory diet, lots of vegetables, lots of fruits, lean meats, staying away from alcohol, all these things can be very beneficial for us and play a very crucial role. And the last thing, I kind of combining all these in one topic, and I'm not a big bullet points person because I always feel like we get distracted in the bullet points and not the topic overall. But these are the way that I see it, that there's a physical side, there's a health wellness side, and then getting involved with a healthcare professional that cares about your well-being, cares about your health, and actually listen to what you're saying. And get you in contact with the right counselors or nutritionists that might be able to help you get the goals that you want. Sleep is a completely another topic for me because I think it's the paramount of many of our ailments in the pain medicine world. Nearly all my patients that have chronic pain have some sort of sleep disturbances. And as we saw back in that summary, that questionnaire we had a few slides ago, that also showed sleep was one of those modalities that we wanted to keep track of. Some good sleep habits is creating a bedtime routine and make sure that it's a fairly consistent routine throughout the week. Avoiding bright lights an hour before bedtime, avoiding highly sugar foods before bedtime, avoid snacking. Some other good habits to have is sleeping in a cooler room and bundling up with extra blankets tends to be a good habit. Sleeping in a dark room tends to be a good habit. Not having your cell phone sitting next to the bedside or in arm's reach, because all these things can actually disrupt your sleep, even at the smallest level. If we can increase our sleep, maybe some of those painful days become less painful. And not only for the pain side, but also for our mood, our well-being, being able to process the day and be able to tackle the goals that we have each and every day. I think it's an important thing. I'm a big advocate for sleep because of this. Sleep disturbances, whether that be because there's a loud noise or because you're not sleeping well, whatever it may be, this can actually increase our pain throughout the day, but also at night. And we start to constantly think about the pain and, oh, I don't want to go to sleep because I'm very concerned I'm in so much pain and I don't want to wake up because when I wake up, I'm in pain. And this becomes a very destructive mindset where we want to be constructive. We want to understand what pain is and how to put proper tools in our toolbox so we can handle this more appropriately. And it's important, some patients don't realize that a sleep consultation with a sleep expert might be warranted. They may want to see if there's other reasons why your sleep is disturbed, such as sleep apnea, where we don't get enough oxygen to our body, so we never get a full night's rest because of that. And sometimes our sleeping positions and our sleeping conditions can cause some issues. So getting in touch with a sleep consultant might be worth looking into as well. Here is the next portion, and these are more things I do in my practice day to day. Interventional pain procedures. We use them to diagnose and treat chronic pain, and we target at the source. But none of this is a cure to the problem. This can just decrease the amount of inflammation, decrease the amount of we will say nerve sensitivity that gets relayed up to the brain, as Alicia was talking about. So we can decrease it, but the tissue damage, the inflammation, it doesn't really go away. It just gets dampered down a little bit. These are different types of nerve blocks, steroid injections. Some people call them epidural steroid injections. You have radiofrequency ablations. Sometimes you have spinal cord stimulations or different types of peripheral nerve stimulations. These are all viable options that we use in the interventional world. But this is just one part of the puzzle. And we can't just take it that this is going to cure anyone, because the rest of the puzzle is much bigger. Regenerative medicine, there's starting to be more and more research based off of this and how it can heal tissue, it can decrease pain, and it can also offer a lot of upside to get people back to be functioning. Unfortunately, right now it's not covered by insurance companies, and a lot of places are doing bad practices with these kind of regenerative therapies. So if this is somewhere you would like to go, I recommend discussing with someone that's an expert in the field in your area, and not someone that just advertises it all up and down all the time. And to the last point, any of these procedures should be performed by qualified healthcare specialist. I did an additional 1.5 years of training to be trained in these interventional procedures. There are people out there that don't have that much training, and they maybe have a weekend course, or maybe they learn from their higher up, their superior, their mentor for a few weeks. I don't feel that's safe or adequate training for these kind of procedures. I talked about strength training previously. Again, there's many benefits. It can improve your functional abilities. That means what can you do day to day, whether that be carrying the groceries, sitting down, standing up without having to lean on something or use something to help you get up, getting up from the floor, playing with kids. These are all very functional goals that we need to have day to day. We can increase muscle strength and reduce pain. Muscle strength can be proportionally linked to decrease of tendon injuries. This is where we work with our physical therapist colleagues and our strength therapist colleagues, and getting patients in a good strength training program, one that's adequate and fit for you, because everyone's different. And one of the keys to strengthening the body is consistent and progressive overload, which means if one day I'm able to pick up a 5-pound weight and move that around pretty easily, then maybe the next time I want to use a 7.5-pound weight. And we continuously go up and up, not to hurt yourself, but get to a point where you're getting a little bit stronger each time you're working out. And then this last slide is probably one of the most important for a lot of patients out there, because it's very easy to get on opioid medications and say, that took care of my pain, I just want to live my life. Well, there's been further and further recommendations based on further and further studies. And this isn't my goal to be shaming anyone that are on these medications or make you worry that there's a problem if you're on these medications. I just want to shed some light so we have some more insight of what our newer research shows. We have newer treatment, non-opioid medications that may work for you. So I recommend discussing with a licensed pain specialist and seeing if some of these treatment options are viable for you. We have psychological interventions, whether that be cognitive behavioral therapy or guided meditations, et cetera, et cetera. Having a proper assessment. Sometimes a patient will come in and say, I have pain, and their doctor doesn't believe them, or they get shoved around and nothing really gets resolved. So this is where the specialization of medicine is important. And you can see here, opioids are no longer recommended as a first line treatment for chronic pain. Actually, they're not recommended for chronic pain at all. There are patients that do absolutely need this. So there are some patients that are acceptably on these medications for the right reason. That's only a discussion you and your healthcare provider can have. But the potential long-term side effects of these medications include not only addiction, intolerance, and overdoses, but can also cause hormonal imbalances, sexual imbalances, and sexual problems. It can affect our breathing and our heart and the development of our brain. So these are all other things that we kind of want to look at from both ends of the spectrum and say, is this the right treatment option for me? We have tons of different options as well that are therapeutic, such as yoga can be beneficial for some people, but tends to be a very common one doctors recommend. The evidence goes a different way with a certain type of modality called Tai Chi, which is a kind of a movement meditation, making your body aware in space. This actually has some pretty good evidence, and I encourage you to check that out in your area and see if there's a Tai Chi instructor or Tai Chi classes around you. If not, I'm sure you can find some stuff online. Here are just some classes of medications you should discuss with your physician with and see if they're right for you. Cymbalta, also known as duloxetine, labeled as an antidepressant in the past, but we've also seen more recently that it can help with chronic pain. Muscle relaxers such as baclofen can help muscle pain and spasms. Gabapentin and also its cousin drug Lyrica can commonly be prescribed for neuropathic nerve pain specifically. And every patient is different. So what might work for you might not work for someone else. And this is why it's really important not to do medication sharing and experimenting with medications, really following the guidance of your physician to know what medication might work with you. And with that, I'm going to swing it back over, and I think this is Alicia's slide.
Thank you, Dr. Verma. So cognitive behavioral therapy helps us to understand the relationship between our thoughts and our feelings and our behaviors. And with chronic pain, it affects all of those things. Chronic pain impacts how we think about ourselves, how we feel about ourselves, and ultimately what we do. And the whole purpose behind cognitive behavioral therapy is not to get rid of the pain, but to make your life bigger, to make those things that are important to us stand out more so that we can live our lives more fully. You can go ahead and move to the next slide. I'll tell you a little bit about some of the interventions that we use. So here are some of the common interventions that we utilize in therapy with our clients. We work with a cognitive side of therapy, helping people to identify and challenge those negative thoughts and reframe them to more positive, functional thoughts. And the emotional area, we work on relaxation. We help with emotional identification, body awareness through, guided imagery. And then on the behavior side, we utilize exercise, time pacing, enhancing your social life, and working on sleep hygiene. And I think that Francesca is going to talk to us a little bit more about mindfulness.
Yes. So mindfulness-based interventions are supposed to be, actually, there is a lot of research on it, and they're extremely powerful. Dr. Verma was explaining how we need to take care of our body, sleep, nutrition, exercise, strength training. And I feel like, we train our body and we need to train our mind as well, okay? Let's start with the definition of mindfulness. John Kabat-Zinn defines mindfulness as paying attention in the present moment to the present moment, without judgment, intentionally without judgment. So paying attention to the present moment intentionally and without judgment. I'm repeating that for me, but also for you, because I think those are very important concepts. So with mindfulness meditation, we're not asking you to do anything with your experience. We're not asking you to change it, to modify, to alter your experience. You're going to notice, so basically paying attention is really becoming aware of what's going on with you, your thoughts, your feelings, your emotions, your physical sensations, without changing anything, right? In the here and now. So we're not projecting to the future. We're not stuck in the past. We are in the present. And without judgment, which is the most important part, right? Actually, intentionally. So it means that we're actually intentionally on purpose, right? Paying attention to what's going on with us. And we try to do it without judgment because research demonstrates more and more that self-compassion, being kind to yourself, being, able to recognize, when you struggle and actually encourage yourself, motivate yourself from that place of love and not like attacking yourself or criticizing, which is usually what we do every day almost, right? They say, I should be doing that. I'm lazy. I'm not doing this enough, right? We're never feeling enough, right? We're always judging and attacking ourselves somewhat, right? So mindfulness can promote relaxation, but it's not the goal of mindfulness is not to relax, but is actually to become more aware, okay? So that we are actually able to respond instead of reacting to our experience. And when we become aware, we become more awake in a sense, right, of what's going on with us. We're able to see that we have options, that we can choose from different options and alternatives, and we can actually respond in a way that is helpful and effective, right, even to our pain. So mindfulness actually promotes relaxation, can decrease tension in the body, can help with, emotional regulation, and also it really, increases the ability to focus on what you want, right? So I really would like to do an activity with you. I know we were supposed to be, to do this as a part of an interactive kind of conversation with an audience. But I think you can still do it if you're listening to me from home, at your office. This kind of meditation I'm actually proposing to you is something you can do anywhere because it's about using your breath, okay? And you have your breath. First of all, I love the breath because it's in the here and now, it's present, right? And then you can do it at home, at work, wherever you are, you're always with your breath, okay? So if we go into the next slide, thank you, Dr. Verma. So there are different relaxation activities that you can do, and there is more than that. I just mentioned a few in this slide: the progressive muscle relaxation, deep breathing, guided imagery. Part of our job as counselors is really doing some psychoeducation. So teach our clients skills and, tools and that they can use at home in their life, in their daily life, because they meet with us usually for like 60 minutes during like once a week or every other week. And then the rest of their lives is with themselves, right? At home or at work. So I think it's really important that they can have tools they can use wherever they are and independently. So the progressive muscle relaxation, it's really about learning what it feels to relax. So we are usually asking clients to tense and relax different muscles group from head to toe. With individuals suffering from chronic pain, I would say that it's better to do it with some modifications. So I will probably recommend it to do it at first, at least with a professional, with the healthcare provider, a counselor, someone who can guide them through it, and again, do modifications to that. I think in our practice, for us, it's really important to adapt our interventions to the needs and the uniqueness to each individual. And so it's really important, it's hard to give suggestions, without knowing who are you talking to, right? So I need to collect a psychosocial history and to get to know the person, right? So now we're giving you very general kind of, right, tools and suggestions, but we also want to make sure you have some direction at first, some guidelines when you start using some of them. So PMR can be very powerful, guided imagery, which is another form of meditation, deep breathing, and let's start doing together. Let's do together this activity. It's called mindfulness of the breath. And this is something you can do at home right now with me. So you want to start by sitting in a comfortable position. Ideally, you want to uncross your legs. Try to relax your shoulders, your jaw. Yes, I love Dr. Verma. Exactly. That is exactly what you need to do. So if you feel comfortable and safe, you can close your eyes. Otherwise, you can keep it open. Gaze to a point. And what I'm asking you to do is really to start paying attention, to direct your focus, your attention on your breath. And you can do it by focusing on the breath or the air at the level of your nostrils, your chest, or at the level of your belly. Or you can alternate and switch between different spots in your body. I'm not asking you to make it deeper or slower. It's not about changing the breath. It's just about observing, noticing what's going on. Just be curious about it. As you do this, especially at the beginning, you're gonna notice that your mind wanders. And it's okay, it's very normal. And it's about, you don't need to do anything, just bring it back to your breath. Just notice it and bring it back. You're gonna probably notice thoughts, feelings, physical sensations. All part of your experience. Do not stay with it. Do not push it away. Just notice and bring it back. Bring it back to your breath. Feeling the air in and out of your nostrils. Your chest expand. Belly. You can even actually bring your hand to your belly. Feel the physical sensations associated with that. It's really important that at first, you're gonna notice your mind is gonna wander a lot. You're gonna bring it back, bring your attention back many, many times. It's kind of a training I was referring to, right? It's a process, it's a practice. It doesn't happen overnight. It takes consistency and repetition. And it is extremely powerful if you're able to do it, when you're able to do it consistently. So you can do this activity, this meditation, anytime you want, even several times a day. And for a few minutes, 10 minutes, I usually use an app. One to remind me of that. Just sometimes they set an alarm and, I have the app remind me, hey, it's time to breathe. And there are plenty of apps, out there you can use, like Calm, Sight Timer, I think we're going to share some resources toward the end of our presentation. So, and we're also here. If you're interested in learning more about mindfulness, we're here to help you, really, and to guide you through and to teach you how to incorporate these interventions and techniques more and more into your life.
Thank you, Francesca. I'm super relaxed now. So I thought that it would be a good idea to talk a little bit about what to expect in counseling, because I think a lot of people choose not to go find a counselor because they don't really know what's going to happen. So I thought we would talk through maybe the first session so that you can get an idea of what's going to happen. So firstly, it's important to note that in your first session, you're going to get respect, you're going to get attention, you should expect collaborative efforts from your provider. There are probably a multitude of assessments that we're going to do, and one of those might be the Biopsychosocial rating scale that we showed you earlier. But we're also going to talk to you about your pain. We're going to try to get to know and understand more about where it's coming from and what your experiences of pain are and how it's affecting your life. Your therapist will also do a thorough assessment. We're going to do a thorough psychosocial history to find out where you've come from and all the things that have brought you to today so that we can figure out how to move you forward. At the end of the assessment, we're going to work on developing some treatment goals so that we're all on the same page with what you want to work on. And also you can expect homework. Maybe not during the first session, but moving forward, maybe in the first session. We feel like homework assignments are really important in counseling because it's important to practice the skills that you're learning in counseling so that way they can become more natural, so they can become more ingrained over time. And that way you can actively practice the exercises like mindfulness, like Francesca shared with us today. But also you're going to expect in counseling for your provider to be working really closely with your doctor, with other providers, because it's really important to have a collaborative effort in your care so that we're all on the same page. And I think what comes next? Oh, conclusion.
All right, guys. Thank you guys so much. Francesca, that was very relaxing, and I think it's a great habit to have, even if you're not in chronic pain. For us to practice that and bring our mindfulness back, I feel it even in my own body, how I just feel more relaxed and more level-headed, and I can go on to my next task for the day. So to wrap it,
But can I add one more thought
please.
about that? It seems kind of almost counterintuitive because I'm basically asking, so people may think about, hey, I am in pain. You're asking me to pay attention to that pain, right? And the reason why I'm saying is that yes and no, because as you become more aware of your own experience, right? Instead of getting stuck in the pain, you are able to respond and to move on, right? So the idea is that you don't want to stay stuck with the thoughts and the feeling associated with that pain, but you want to move. You want to keep moving, right? And the mindfulness, as you practice, helps you start moving again and doing and act on it and doing the things that help you really living again, being happy again, right?
Absolutely. And not to get too scientific with it, it has a lot to do with the prefrontal cortex and our amygdala and our hippocampus. Conversation for another day. If you do have interest in that, feel free to reach out to us and we'll explain that. So, in conclusion, our purpose for doing this was not to get more patients for me or more patients for them. I think we really have a care for the community that we wanted to do something with no strings attached. Just throw this out there and give the tools available for you out there that may be struggling with this chronic pain that, there is and there are ways to help you cope with this. And there are ways to get you to the next level. All treatments are individualized. This isn't a one size fit all. That's why we never wanted to just make one book about this or just one course about it, because it's not fair for the individual at that statement. Everyone's coming from a different place, and it's multidisciplinary. Every single portion is one piece. And unfortunately, for some people out there, you are the biggest piece. You are the hero of your story. You're the one that's going to conquer your own pain and conquer your own life. We are simply tools that are accessible to you to get you to that spot. And when we say we, I'm communicating as all healthcare providers out there. We're continuously doing new and new research, having new and newer technology. I'm not a huge technology person when it comes to these things because we have so many free tools at our access, so many proven methods that we're just not even capitalizing on right now. And I really encourage you to go that route first. But if we need to come down to medications and technology, we have those available. We're still looking for more holistic approaches, whether that be medication or supplementation or different activities. We're still trying to figure it out. Chronic pain is still relatively new to us, so we're still trying to figure out how we can treat this more accurately. I am a type of person that if I have a problem, I try to learn everything about the situation and I try to fix it from as many tips and tricks and trades that I can figure out. And then I figure out which ones work for me. I hope that you take that on your own responsibility too. We're giving you tools. I want you to be encouraged that you can definitely take these tools and use them to your advantage. And getting partnered with the right healthcare providers, right counselors and clinicians, physical therapists, chiropractors, I think these are very, very important. So I've made it a mission to reach out to people in my community that I trust very much and I feel comfortable sending my patients to. And Dragonfly obviously being one of them. And I've tried to refer several patients their way. But anyways, I appreciate everyone's time so much. We thank you for following along with us. Everything will be posted on my YouTube channel. So feel free to look for Dragonfly's information, my practice information there. And also, again, a special thanks to Saluda for sponsoring this event, especially Ashley Smith, who went out of her way to make some accommodations to make this all happen as well. So thank you guys very much. Hope to talk to you soon.
Thank you.